Wednesday's webinar. Myself, Adiba Alaudin, speech language pathologist, and
myself, Khadija Nisha, speech language pathologist. Here we'll be discussing on the topic Williams syndrome. The topics covered will be what is Williams syndrome, causes, symptoms, and how do we prevent it.
So, moving into the topic, Williams syndrome. First, let's look into what actually Williams syndrome is. Williams syndrome is a rare genetic condition, and children or adults who have Williams syndrome have unique physical features, delayed cognitive development, and potential cardiovascular problems. So when we look into the life expectancy of children with Williams syndrome, they have a normal life expectancy. But due to the presence of other problems which they have after the diagnosis, it might affect their prognosis. Williams syndrome also has another name. It can be called as Williams-Burren syndrome. As I told before, people with Williams syndrome will have unique physical features, their cognitive development will be delayed, and they will also have cardiovascular problems. Looking into the growth factor. The growth is like when you compare, like when the child grows up into an adult, they would be shorter than the average adult. And they would require routine urine and blood tests because in the body of people with Williams syndrome, there will be presence of a lot of calcium which can affect their kidney. And they also have an underactive thyroid gland and their puberty can occur earlier. So all these should be kept in mind. So when we see about how Williams syndrome affects the child. So when the child is formed, what happens is a piece of chromosome 7 goes missing. So this is a genetic condition. But this is not something which is passed on from the parent. So this is not inherited. But people, that is adults who have Williams syndrome, have 50% chance of passing it on to their kids. Looking into how common Williams syndrome is. Williams syndrome, as I told before, is a rare condition, but on an estimate, it occurs in 1 in every 10,000 live births in the United States. So you might all have questions about how Williams syndrome affects your child. Because of the diagnosis made, they might face a lot of challenges in their life, but they can reach their full potential through early intervention and treatment. Children with Williams syndrome may also have birth defects. These birth defects include heart or blood vessels which are around the heart. As I told before, cardiovascular problems. So how do we fix these? They have to undergo a surgery. And as I told before, they need to have continuous, that is routine, urine and blood checkup in order to protect their kidney because of the presence of a lot of calcium production in their body. Compared to the normal kids, children with Williams syndrome might walk, sit a little later because they have looser joints. And as children with Williams syndrome have a very strong verbal and communication skill, their cognitive delay is always masked. Because when a normal person sees them, they think that they are all good because they have a very strong verbal and communication skill. So when we see into the cognitive side, learning letters or numbers and differentiating between the real and the abstract object or world or the spaces between different objects would be very difficult for them. But it is often masked, as I told before, because of their strong verbal and communication skill. Children with Williams syndrome have an excellent long-term memory. But what happens because of this is sometimes they might experience ADHD, which is Attention Deficit Hyperactivity Disorder. Now let's look into the causes of Williams syndrome.
Since my friend Adiba mentioned that a deletion or missing region in the chromosome 7 causes Williams syndrome, we know chromosomes are made of we have 46 chromosomes which are paired into 23 of us. These chromosomes have each copy of our parents, and in this chromosome we have segments called DNA, which is known as genes. These genes act as a manual instructions to our body. So when there is a missing region or deletion in the chromosome 7, the instruction given from the chromosome 7 will be affected.
Now let's look into the symptoms of Williams syndrome.
Williams syndrome symptoms will
Range in severity.
and all people will show different symptoms. Let's move on to the symptoms. The symptoms include chronic ear infections, dental abnormalities, elevated calcium level, endocrine abnormalities, feeding difficulties, sleep problems, and unsteady walk. As my friend told, the serious conditions include heart diseases, increased blood pressure, irregular heartbeat, and cardiac failure.
They may also have narrowing of blood vessels, as I told before, the cardiovascular problems, so the heart might be affected, or the blood vessels which are around the heart might also be affected. So what happens to these blood vessels is that these blood vessels get narrowed. Moving into the unique physical features. So how do we identify that a child has Williams syndrome? So when you see a child, we can easily diagnose, like by looking at them, we can say that they have Williams syndrome because, as I told in the beginning, they have unique physical features.
Like small jaw, upturned nose, prominent lips, and large ears, full cheeks.
And their mouth will also be open. And when you look into their teeth, they have very tiny teeth. Moving on into the diagnosis of Williams syndrome. So when is this condition diagnosed? When your child is a baby or at their early stage, that is during their early childhood, this is diagnosed. So whenever your healthcare provider suspects that your child has Williams syndrome, they would recommend for a physical examination, which would be followed by a genetic test. So why are we doing a genetic test? When we do the genetic test, it is done through the blood. So when we do this, we would be able to identify the differences in the gene. As mentioned before, the DNA, which is the instruction manual in our body. So it controls about how we behave, how the whole body is controlled. So through this genetic test, we would be able to identify if a small piece of chromosome 7 is missing. In case it's missing, we can say that
we can diagnose it as Williams syndrome.
So apart from the genetic test, as I told that the child might also have other problems which might affect their prognosis, your healthcare provider might recommend for additional tests. So these, again involving the heart, might require an echocardiogram, which is an ultrasound of the heart. And through this, you would be able to identify the irregularities which are present in the heart. Maybe because of the shape or how the heart is structured, the presence of the blood vessels, how the blood vessels are present, how they are pumping blood, and the narrowing of the blood vessels, everything can be found out. Then we would also check for the child's blood pressure to see if there is any abnormality, because the narrowing can cause pressure. Then we would be checking the child's blood and urine again. Why? In order to check the presence of excess amount of calcium. In case calcium is present in excess amount, it might damage the kidney of the child, which would again affect the child's intervention. Moving on into the management and treatment. So once the physical finding is done and your healthcare provider finds out that your child has Williams syndrome and the genetic results turn out positive, what they would do is that they would meet you, who would be able to give a better idea to you, because they would be able to tell you about where the chromosome is missing and how the chromosome is structured. This would be discussed with your family. And your healthcare provider would also tell about the management. They would tell you about the recommendations which based on the diagnosis made. For Williams syndrome, there is no specific cure. It cannot be cured. But the side effects which occur along with Williams syndrome, they have to be treated. Otherwise, it could get the condition even worse. And a very important point which has to be kept in mind is each child is completely different. If child 1 has Williams syndrome and child 2 has Williams syndrome, maybe the diagnosis is the same, but the treatment and management cannot be the same because every child has different needs and every child is different. So the treatment and management would differ for every child. Regarding the heart, a formal evaluation will also be done by the cardiologist. In case a problem is found in your child's heart, the cardiologist would recommend the best treatment for you. Then we have to enroll your child into an early intervention program. That is either therapies or special education. Why? In order to alleviate their developmental delays, the learning problems which they have. And because of the presence of elevated blood calcium level, you have to visit a nutritionist or a nephrologist, and they will help us know about the fluctuating calcium levels which is present in the body. So when that is found out, we can, again, as I told before, we can prevent the kidney from getting damaged. Because if everything gets damaged together, again it would affect the child's development, like the child would not be able to progress in life. So as Williams syndrome cannot be completely cured, like there is no treatment for Williams syndrome, these which are the side effects or like the other problems which are present when a child has Williams syndrome, they need to be cured. Otherwise it would be difficult for the child. And in case there is any additional symptom which is present in the child, in case you find out there is any other thing which you have to discuss with your healthcare provider, they would help you visit another specialist in order to get that clear. Moving on into the prevention.
So how can we prevent or how can we reduce the risk of Williams syndrome? Like I said before, it is an inherited disorder, which it is not an inherited disorder, which means that it is a genetic condition. This Williams syndrome cannot be passed on by a parent unless and until if both the parents are diagnosed with Williams syndrome.
But sometimes the parent, like in few cases, parents who are affected with Williams syndrome have 50% of passing it on to their child. So you cannot say that it is an inherited disorder completely. It's basically a genetic cause.
Outlook and prognosis. What can I expect if the child with Williams syndrome? Williams syndrome cannot be cured. We can, but the treatment we look forward to is to reduce the symptoms and improve in their daily routines.
So sometimes you might be worried about what to do, like you might be scared about, what would I do if when I get pregnant, I get a child with Williams syndrome. So what you can do, that you can meet with your healthcare provider
and do a genetic test.
And through the genetic test, your genetic counselor would counsel you about the chances. As I told before, children with Williams syndrome have a normal life expectancy, but due to the presence of other conditions, it might affect their prognosis. So for some kids, their life expectancy can be reduced. This is because of the complications which is present. So cardiovascular problem, if in some people, if it cannot be cured completely, it might reduce the life expectancy of the child. And kids with Williams syndrome, or generally people with Williams syndrome, sometimes need additional support when they are growing into adults. So moving on into living with Williams syndrome. So how do you take care of your child? As I told before, every child is completely different. Every child has
Different needs. So with love and support, we can do much better and improve their treatment.
because when they are enrolled into therapies, if as a parent you are not motivated enough, or if you are not providing support to your child, it might not be beneficial for the child, because according to the child, you are the first hand that they run into, you are the first person that they come and discuss their problems with. So you need to be extremely calm. You have to provide a lot of love and support for your child in order to bring about a change in this child's life. And children with Williams syndrome, again, they might require regular healthcare checkup, and because of the presence of other conditions, monitoring their blood and
levels, they might even have eating difficulties. So all these need to be checked accordingly.
And in case any other symptom arises in between, you have to go and meet your healthcare provider immediately, so that that symptom can be found out and you can provide the proper treatment for that, so that your child is not affected any further. And enrolling into special education will help your child know about the different challenges that they might face in a classroom. So once they get well adapted, once they are confident enough, they can mingle with others.
Other peer groups.
And always be patient with your child. Let them explore, let them adapt. So you as a parent should always be patient, and you should always be motivating for your child. And if a question arises about when should you go and meet your healthcare provider. So when a child is born, there are milestones, developmental milestones, which the child has to achieve. So in case your child misses out the developmental milestone, or you feel that this is when my child is supposed to talk, but my child is not talking yet. This is when my child is supposed to sit, but my child is not doing that yet. So when you feel that the milestones are delayed, you have to go meet your healthcare provider immediately. And then, as mentioned earlier,
if the child has any breathing difficulty, or if you feel the child has any heart problems, you should immediately meet a healthcare facility.
So also if they have any hearing problem, that is a hearing loss, or they have continuous ear infections, or they have trouble eating, you have to go meet your healthcare provider. Looking into when you should visit the ER. When you see that your child is starting to show heart diseases, that is cardiovascular problems, you have to take them to the emergency room immediately. So what are the symptoms which you can see when your child has a cardiovascular disease? They breathe quickly, that is they have breathing difficulty.
They will have blue or purple lips. They will have difficulty in swallowing.
And they also have eating problem, as mentioned before. And as they are breathing very quickly, their heart starts pumping very fast. So they have a faster heartbeat. And throughout their body, they will start getting swelling. The questions which you can ask your doctor. You can ask about when your child needs to meet a specialist, or in order to address any symptom that your child has regarding Williams syndrome, you can talk about that to your healthcare provider. When, again, as I told before, through a genetic test, you can, before you become pregnant, you can talk to your genetic counselor about if your future child, would receive the same genetic condition. In the beginning, I had mentioned that 50% the parent also has a chance of passing it on
to the
child. So when you become pregnant the next time, you can talk about that to your genetic counselor, and they will be able to guide you regarding that. And you can also ask if your child needs any medication which might help your child alleviate the symptoms which are present.
To reduce the symptoms.
Finally, this is a note which is from a clinic, which is Cleveland clinic, and from them there is a note. So as we know, Williams syndrome is not contagious like how you get a cold. Like you sneeze, the other person who's sitting beside you, they will get the cold immediately. So Williams syndrome is not something like that. It is not contagious. And a child would be extremely friendly. They would be enthusiastic, they would want to meet with others, they would want to make friends, and they would have a very outgoing personality which would make other people really like them. They would want to come and interact with your child. They would want to be friends with your child. So that is a very beautiful characteristics which is present in a child with Williams syndrome. And as mentioned before, you always need to provide support to your child. Your continuous motivation helps the child do better in life. Your continuous motivation helps the child believe that yes, they can do this, because you as a parent are so positive about it. So it would help the child also be positive about their condition, and that would better help in their treatment. And in case you have any concerns or you have any questions, you can always meet your specialist or your healthcare provider and you can talk to them about it. And when you talk to other parents who have kids with Williams syndrome, never compare your child with another child,
because the symptoms will be differ and the needs of the child will differ from each children.
So always look into your child with a fresh eye and never compare them with others, saying that, oh, even that person's child has Williams syndrome but they are doing better in life than my child. No, that's not how it works. You should always be positive about your child, provide continuous motivation for them, and thus be able to bring about a change in their life. So in order to summarize the whole thing about Williams syndrome, as mentioned before, Williams syndrome is a rare genetic condition. So this is not something
that is
which
inherited.
is inherited.
But until and unless there are chances for the parent to pass it on, only is 50%.
And children with Williams syndrome have unique physical features, delayed cognitive development, and cardiovascular problems. Cardiovascular problems are something which have to be addressed immediately for the child, because that puts their life at risk. So in case you find out that your child has a cardiovascular problem, immediately take them to the emergency room. Otherwise, it would make the life fatal for the child. And make sure that in case your child has Williams syndrome, continuously take them for routine blood and urine tests, because this monitors their calcium level in their blood and urine. And children with Williams syndrome or people with Williams syndrome have an underactive thyroid gland, and the puberty might be earlier for them. Looking into the life expectancy, they generally have a normal life expectancy, but due to the presence of other conditions, it might affect their prognosis. And sometimes their life expectancy might be shortened because
if heart diseases they face,
in case the heart problems elevate very badly, it might affect their life expectancy. And children with Williams syndrome are extremely friendly. They have a very outgoing personality, and so everyone around them would always want to be friends. They would always want to talk to your child, and always make sure that you are a very positive and motivated parent, because only then will you be able to bring about a change in your child's life. So that's it about Williams syndrome. Thank you.
Let's move on to the questions asked. First question, Vasu Namala. How can we find a child has autism? If so, will it be cured? Autism is diagnosed by the age of 3 and there is no cure for autism.
But definitely through treatment,
we
can bring about changes. You can bring about improvement in your child.
Krishna Vinay. Ma'am, Williams syndrome affects the personality.
So as I told, your child would have a very outgoing personality. They have a very outgoing personality, they are very enthusiastic. So anyone who sees them would not feel like, oh, this person is affected with Williams syndrome. They would also be motivated to go and talk to your child.
Does it come because of heredity? No, it does not come. Mainly I said it's a genetic disorder, that is a deletion or a missing piece of chromosome 7. But there are chances for it to pass it on. There are 50% of chances to pass it on to the child. Is Williams syndrome curable? No, it is not a curable disease because it affects the chromosome.
But as we had spoken, the symptoms which occur along with Williams syndrome, they can be diagnosed and they can be cured so that it doesn't get any worse for your child.
Williams syndrome affect the intelligence.
The child will have delayed cognitive development.
They will take time in order to learn new things.
In order to think or in order to organize, it will take some time for them. But due to the presence of strong verbal and communication behavior, it cannot be easily identified or it cannot be easily noticed by someone from outside.
Is there any more questions?
Thank you.
Autism spectrum disorder, psychological problems are troubling approximately 80 crore people across the world. Could endanger your children's future too. Pinnacle Blooms Network is probably the only chain of child development rehabilitation therapy centers offering smart goals-based speech therapy, occupational therapy, behavioral therapy, psychological counseling for kids to be part of mainstream society and bring smiles into their families. Pinnacle's Mirracle is 360-degree patented digital platform to bring technology for empowering kids with special needs. Pinnacle Blooms Network is special edu healthcare unit of Bharat Healthcare Private Limited, Government of India's prestigious Startup India awarded futuristic health tech organization. Largest team of proven therapists ready to work with your kid. Contact us today 9100 181 181 for free assessment.